Good afternoon, everyone. Thank you for participating in our poll as you signed on. It was exciting to see where everyone falls who's logged on. Welcome to our webinar this afternoon. I'm so glad that you're able to join us as we discuss young adult health and some of the characteristics of young adults and what makes them unique in their healthcare. My name is Lynn Brettel. I'm the director of the State Adolescent Health Resource Center. And today's webinar is sponsored by the Adolescent and Young Adult Health National Resource Center, of which SARC is a partner. Like I said, we're just happy you could join us for today's discussion and participate in our poll. We'll have hopefully have lots of questions and discussion and make this as interactive as possible throughout the next hour. Let me start with a little bit of an overview about what brings us to today's webinar. One of the 5 overarching goals of our National Resource Center is to advance young adult health by increasing the number of states that are addressing a Title V performance measure that is young adult focused, or an outcome measure that's focused specifically on young adults or encompasses young adults. So to that end, we wanted to provide some resources and support to our state partners or other programs across the country in order to encourage discussion about how we're engaging young adults, what we're doing for them, what the programs are, and then generating some ideas about resources and support that we can provide, that the National Resource Centers can provide, and how can we support each other in focusing more on young adults as a distinct population. A little bit of a preview of this is the first, like I said, this is the first webinar in a series of 3 that's going to address young adult health. So we have 2 more upcoming, one on April 8th that will address specifically mental health and suicide prevention in young adults. And then May 6th is going to focus specifically on the healthcare needs of young adult males. So hopefully you can join us for those as well. Here's what we're going to talk about in the next hour, just by way of an overview. I'm going to describe some of the characteristics of young adults as a demographic. So we'll talk about them in terms of what they're experiencing developmentally, and also characteristics specific to this current generation of young adults. So part of the reason that we had you do the poll at the beginning was to get people thinking of potentially what generation they might land in. I'll describe what we know of the overall health of young adults and discuss some of their healthcare challenges and specific needs facing this group of young people specifically. And we'll end the hour by sharing strategies, having some of our state partners discuss ways that they have addressed young adult health in their work, and maybe some of the programs they've attempted, things that have gone well, successes they've had, and then also the challenges that we all face in implementing those efforts. And we'll try to leave this afternoon offering some resources for next steps that can support you in implementing young adult strategies, or at least getting the conversation started in your state. Let's start a little bit with very basic, so we're all on the same page. Who are we talking about when we say young adults? If you could just type in the chat box briefly if your program specifically defines an age range for young adults, how do you define it in your program? Just quick type it in the chat box. One thing that I wanted to point out as people are doing that, that Andrew brought up in the beginning before we started the webinar, that even though some of the age ranges that people are talking about, or the generations, I should say, we don't all share the same characteristics because the generations are defined by pretty broad age years. So the point is not exactly which generation we all are a part of, but I think thinking about what might be some of the unique characteristics of each of us in the generation we're a part of, and how does that influence the work that we're doing with young people. So I see a lot of people typing in 18 to 25. It's also common for it to be stop at 24. It seems for the most part the upper end that people are commenting on is age 24 or 25. Notice one person said 26, which could be related to the fact that the ACA allows 26-year-olds to stay on there. That's kind of the cutoff date for getting off your parents' insurance plan. So at SARC, we define young adults as ages 18 to 25, as you can see on the screen there. In adolescent and young adult health programs, we often are lumping 10 to 25-year-olds together into one group. And I don't have to tell any of you that this is a huge developmental range. So there's really significant differences between 10 and 25-year-olds, as you all know. So as we're thinking about this, it really, in many ways, doesn't make a lot of sense to be designing programs for 10 and 12-year-olds the same way that we're designing programs for maybe 22, 23, 24, and 25-year-olds. So that's one reason why we wanted to start thinking about this, as young adults are really not just older adolescents. They're a distinct group in and of themselves. What are some of the characteristics that distinguish young adults from younger adolescents? Again, quickly type in the chat box, what are some of the developmental tasks that are unique to young adults? Something that might be, that someone might be thinking of is physical development. That how is that different for young adults as opposed to younger adolescents? Those are kind of the things that I was thinking people could comment on. Yep. Definitely relationships to parents and other caregivers is changing quite a bit. They're starting their first job. Great. Their society considers them in charge of, they're legally an adult, lose their insurance privileges sometimes, stabilizing puberty effects. Brain frontal development, absolutely. You can drive, you can vote. Great. All of these are things that are young people, young adults are working to achieve, moving from child-focused systems into adult-focused systems, choosing education, whether they're going to go to school or work and learning. Great. All of these things that are things that we're going to briefly touch on in the next hour, because these are really some of the key tasks that young people are working on. So first, I'm going to start talking just a little bit about some of the general developmental characteristics that distinguish young adults from younger adolescents. Again, there's a lot of individual variation in how each young person develops, obviously. So even though they reach these developmental milestones at different rates, they all generally have to achieve some of these major tasks at some point. So like we commented on earlier, physical development is mostly complete by the time young people reach the age of 18 or 19. Particularly for females, they reach physical development, their adult form, so to speak, a little bit earlier than those born as males do. Sometimes males will grow up until age 21 or 22. But for the most part, physical development is complete, which means that for many young adults, they have more sense of acceptance of their physical body than we see in younger adolescents. With the completion of that physical development, young adults now have to adjust to a sexually maturing body as well, and some of the feelings and emotions that come with that. And obviously, a huge part of a lot of the programming that you all do is helping them learn to establish their own values for sexual behavior and the skills that are necessary for romantic relationships. As many of you commented in the chat box, a hallmark of young adults is kind of this increased capacity for abstract thought and complex decision making. We've all heard so much about brain development in young people, so I know that this is not new information, but it bears repeating that it really distinguishes young adults in making them more capable than younger adolescents for holding multiple perspectives at once, considering different points of view, and appreciating that there might be many solutions to one problem, which is often a task that's harder for younger adolescents. And the brain isn't developing as much in the same way as it's restructuring and making new connections and pruning away the connections that are not getting used and that the brain doesn't need, and really solidifying these new connections that young adults are needing to make these complex decisions. So along with this, increased ability for abstract thinking fosters their ability to formulate their own personal value system, which may or may not differ from that of their family. At this point, their decisions may be less influenced by their peers than they were when they were younger adolescents. And this increased cognitive and emotional independence is also coupled with increased physical independence. And all of this translates into a renegotiation of relationships with parents and caregivers and other family members who may be a part of their everyday life, which is a crucial task of this age group, which also was mentioned in the chat box. They have to learn to live on their own and have increased physical independence and establish this stronger sense of who they are and what they're doing in the world, and wrestling with what their place is, what their purpose is, and what they want to do with their lives. And benefit of this part of their life for most young adolescents, or young adults, I should say, excuse me, is that in general, conflict with parents tends to decrease as a young person gets older. I think one of the challenging parts for working with young adults is that they often look and sound like full-grown adults. And we have to still remember that they're really in the stage of learning some of the basic life skills necessary to take care of themselves independently. So things that are shown here, like managing money, going to the grocery store, meal planning, managing stress, managing a job, perhaps their coursework, all these things on top of each other are, that may become second nature to those of us who've been adults for quite a while. These are things that they're learning. And so we have to figure out ways to remember that and understand that and support them in that development, just like we would support a toddler walking or a 16-year-old learning to drive, that it's a practice as opposed to something they automatically wake up knowing how to do when they become an adult. A key task, again, is helping support their increased need to create stable relationships with peers and other social systems of support. Because these things are changing so much for young adults, they need help in developing the skills that are necessary to solidify their own systems of support that are often now going to be somewhat independent from their family, and for many of them very independent from their family. So again, just like younger adolescents vary in how they develop and the pace that they develop, it's true that obviously young adults vary in how they develop, but this is just kind of a general overview of many of the tasks that they need to accomplish as young adults. And as I mentioned earlier, so many of our systems and structures are set up in a way that assumes that the day a young person turns 18 or maybe 21, they automatically turn into adult and know how to do all of these things. So we need to develop the processes that can help support them as they're in this phase of development. I want to turn now to thinking specifically about the young people of today, young adults of today, and thinking about the context that they grew up in, the world that they live in now, and many of the things that are happening around them, not just with their health and their development, but all around them. So like you can see on the slide here, what are some of the words that you hear people use to describe young adults today, either in your social circles or in media? What are some of the words that you hear them described with? I see millennials, and this can be good and bad. And if you are hearing things that you don't necessarily agree with, put those in the chat box too. Right, we hear entitled, lazy, perhaps, connected, stressed, multitaskers. All of these things very true. Socialist, self-focused. And as people are typing in some of the things that they hear about young adults, the next question I'm going to ask as I read off some of these is, how does this match with your experience working with young adults? I see passionate, idealistic, fearless, educated, entitled, overwhelmed, kind of a whole host of things. So I'm curious to know, in your work with young adults or young people in general, do these words match with your experience, or is your experience different from a lot of these words? If you want to say just a couple of those things in the chat box. I think, not surprisingly, you know where I'm going with this, that for those of us who work with young people and care about them, we often feel like young people, young adults today, um, are viewed unfairly, and that many of these words do not accurately describe our experience with them. And so, like Ellen is saying, youth are frequently generalized and underestimated. And sometimes when we see examples of the great things young people do, we tend to, in general, people will think, well, that's just, you know, an anomaly, when really those of us who work with young people have all these amazing experiences of how wonderful they are as motivated to change the world and energized, and that multitasking and being connected is a great thing for how they work in the world and how they make a difference. Yeah, so Carol is saying that there's a different attitude. They're more connected, and it affects how they see things around them. So let's get into it a little bit, and what are some of these characteristics? Who are the young people of today? Generally, as a group, this population spans 2 generations. And as I said before, you know, exactly which generation that everyone is in is not the most important takeaway from here, but I think it adds a little bit of context about who young adults today. And for many of you, as you entered the webinar, the largest percentage of folks on this webinar technically belong to the millennial generation, and many of you would fall into this category, into one of these 2 categories. So it's interesting to think about how, if there's any overlapping characteristics for the people who are on the webinar today. This generation of young people spans 2 generations, so kind of the younger end is Generation Z, born between 97 and 2012, and then the older end is, you know, Generation Y, or millennials, born between 81 and 96, which again is a pretty large range. Roughly, as a group, they make up about 9% of the US population, and that was as of 2017. So Generation Z is the most racially and ethnically diverse generation in US history. They're also the largest generation in US history. It's really kind of remarkable to think about. And what does this all have to do with their health? As we think about, you know, I bring this up because as we think about how to support young adults and their health and well-being, we have to consider how their experiences with social determinants of health, negative social determinants of health, and racism, specifically for young adults of color, or things like income inequalities, access to housing, employment, how those things affect their overall health. And as we know, too often, young people of color are experiencing these kind of disparities at much greater rates than perhaps their white counterparts. So it has an impact when we talk about health. These things are all interrelated, and we need to keep these things in mind. As you all mentioned, really important part of describing young adults today is that they are wired and they are connected. We hear the term social natives, or, you know, technological natives. So things like social media, touch screens, high-speed bandwidth, Wi-Fi have always been a part of their experience. They have 24/7 access. They're used to having 24/7 access to information. And have just grown up in a time where there's been dramatic improvements in technology happening regularly, and it's really shaped their experience. The first iPhone came out when the oldest in this generation was 10. So they grew up texting with a texting mentality, and in general are more attracted to video-oriented social platforms, respond to edgy visual campaigns, and consume information incredibly quickly. So that means they can multitask across multiple screens, communicate with rapid fire banter, and are really experts at sorting quickly large amounts of content. The point of all this being that we might only get a few seconds to convince them that our content is worth their time. So we need to convince them quickly that so they'll engage with us and learn and kind of go on the journey with our programs that we're intending. And so it makes us think about, how do we design programs? How are we putting things out? And how are we engaging young people in the design of those things? I know it might seem obvious, but it I think is tempting for those of us who didn't grow up with all of these things at our fingertips, that we can discount those things, but we really would be foolish to ignore how much this is a part of the context that young people are living in, and we need to be smart and strategic in using that and capitalizing on that when we design programs. One more point before I let this part go is young adults, like I said, they don't simply consume information, they also help create it, and they like to create it and be a part of creating it. So either if it's posting original videos or forwarding content, helping create it, they really love to do that. And so if we're smart about partnering with young people and engaging them in the development of programs, I think our initiatives and strategies are going to be much more successful if we're cognizant of those things. Some other descriptions of young people growing up, young adults today, is that they have really grown up in chaotic times. If we think about the context they've grown up in, it's been a post 9/11 world, post Columbine world, post housing foreclosure crisis, and all of these things have kind of a major impact in the context that they've grown up in, that they've really never known a world free of global terror. That's been a kind of a daily part of our conversation. Many of their families experienced firsthand the Great Recession and the housing foreclosure crisis. So these things are shaping their experience. Since the Columbine shootings in 1999, more than 228,000 students have experienced school gun violence. And since 2012 alone, the US has experienced more than 2,000 mass shootings. This has a major impact in the context, as you know, of the world that young people are living in. Another major part of their context is young adults are getting poorer than counterparts in previous generations. They are the only demographic for whom poverty has increased since the early 70s. Poverty has fallen for most other age groups. So this translates to mean that 1 in 5 young adults live in poverty. And among 21-year-olds, the rate is even higher, with almost a fourth experiencing poverty. These trends hold true even when data are adjusted for students who are in college, tuition costs and student debt, and government benefits. This is a snapshot of where young people are living, just a few data points, not the exhaustive picture. I think you probably have heard and know that young people today are much more likely to live at home and for an extended period of time compared to previous generations of young adults. In 2018, more than half of 18 to 24-year-olds lived in their parents' home, and that's according to the US Census Bureau. Not surprisingly, young adults with less education were more likely to live at home than their peers who had a college degree. What's really disturbing, of course, is that some young adults have nowhere to live. You can see here that on a single night in 2018, more than 48,000 were homeless. And of those, 18,000 were unsheltered, which meant they were sleeping outside, in a car, or really someplace not meant for human habitation. And because the homeless population is hard to get data about, likely many young people who are homeless are missed when we count those numbers. Youth aging out of foster care is a really key group that many of us are focused on when we're designing programs. So we know when we're talking about that group that when they reach age 18, 20% of young people who were in foster care become instantly homeless. A couple other places to think about where young people, we might not think about where young people might be living. Young adults make up 43% of active military members, which is really a huge proportion. And they also account for 6% of the prison population. So just a couple other things for us to keep in mind as we're thinking about where young adults are and where they're living. Young adults really do value education. There's some pretty amazing numbers for graduation rates and college enrollment. Like you can see here, 18 to 20-year-olds in Generation Z are outpacing their millennial counterparts at a similar age when it comes to education. More young people have graduated from high school in 2017, almost 80%, which is, and 6 in 10 attended college, which is great. Partly, in large part due to the effort, increased graduation rates for African American and Latino young people. The not great part of all of this is that cost, of course, for college is a major factor and a major barrier for young people in getting into school and making college a possibility, and then for staying there once they get there. 6 in 10 young adults of 21 to 29-year-olds, so a little bit different age group, weren't able to find the financial support that they needed to further their education beyond high school. So young people who wanted to go to school and just weren't able to make the finances work for it to happen. As you know, tuition is astronomically expensive, and textbooks, for example, are about 90 times more expensive than they were in 2006, which is astounding. So those young people who do attend college, oftentimes they come out or leave college because they have so much student debt. So while it's encouraging and exciting that in 2018, more than 3 million students graduated from high school and 2/3 went off to college, more than half of them who start college drop out within 6 years. So again, thinking about what young people are experiencing and the barriers that they're facing when trying to get higher education. So among the world of work for young adults, it's a complex and complicated picture. For the most part, young adults are entering adulthood with less experience in the labor market than prior generations. For those who do work, there are much greater disparities in the labor market, and not all the connections that young people have to the labor market are equal in terms of career advancement, and the prospects for those with less education are more limited than they were in previous generations. The wage gap between young workers with college degrees and their less educated counterparts is also the widest it's been in decades. So who is working? About half of 18 to 24-year-olds work but aren't in school. Among those who do work, 1 in 10 have less than a high school education, 2 in 10 have an associate's or a bachelor's degree, and about half of that group has a high school diploma. When we're talking about unemployment, there's some large disparities in unemployment rates for particular groups. You can see here, unemployment rate for African Americans, 16 to 24-year-olds, is 3 times higher than the overall unemployment rate. So that translates to slightly more than 1 in 8 African American young people actively looking for a job, but unable to find one. When we're thinking about young adults with disabilities, those ages 20 to 24 is who this data is about. About half of them the employment rate for them is about half that of their peers without a disability. So again, thinking about different populations of young people and how we're designing programs and what might be some of the particular characteristics we need to be thinking about. I mentioned young people aging out of foster care, young people leaving incarceration, unemployment, and poverty level wages are very common for those two groups of people as well. So one group that we need to be thinking about and be concerned about is the group of disconnected young adults, which means they're neither working or in school. And this accounts for about 1 in 8 of 16 to 24-year-olds who are not working and are not in school. About half of this group has a high school diploma, and nearly 20% has taken some college courses. But when we're thinking about, what are the consequences of being disconnected, meaning not working or not in school, it's not just that they don't have, they're not gaining education or gaining wages. It's also some of the intangible skills that you get from working and being in school, such as making contacts, gaining credentials, learning unspoken behavioral norms, and generally learning how to be in the world of work in school, gathering a sense of agency and confidence about yourself. So these are some of the intangible skills that young people who are disconnected are not getting, in addition to education and wages. It's important to note, of course, that this disconnection is not just an individual issue, it's a systemic one as well. It's not young adults choosing to become marginalized, but rather being surrounded by challenges that often are beyond their control, and it can take a toll on them. Issues stemming from crumbling or isolated social supports in their communities, segregation, under-supported schools, some of the discrimination and racial biases that I talked about at the beginning. These are all creating a system that lack of support for young people in many of the areas, many of the disconnected youth like I talked about. So before I keep going on and on, I would like to hear some of your reactions to some of this. Again, type in the chat box. Are you surprised with anything that I'm talking about? Anything that I'm missing? Things you're disagreeing with? I would love to hear some reactions to what people are thinking as they listen. So I see somebody's commenting. I don't know if that's what you're surprised about, the 12.5% not working or in school. Surprised by the number of young adults in the military. It's a large number. Poverty statistics are, yes, very disheartening. I feel like a lot of what I'm mentioning could be seemingly overwhelming, and I think paints a different picture of young adults as a healthy time of life. It's a different picture than I think we're often used to hearing. People are surprised by the number not working or in school. So Jason is asking, curious about the data on college enrollment, including trade skills, or trade schools, excuse me. For the most part, and I'd have to go back and look specifically, but the data were 2-year and 4-year colleges. So I'm not sure about trade schools being included. That's a great question, Jason. Lots of people surprised by how many young people are homeless after aging out of foster care. And yeah, the details of where young people are living. It's pretty shocking to see that so many young people are homeless. Thank you for reacting. There's a lot of doom and gloom, I suppose, in some of the data that we're talking about. So thanks for sharing your perspective on that. So let's get to just a few specific things about young people's health, and in particular. I think it's surprising to me to always be reminded that compared to adolescents and older adults, young adults is actually a much less healthy time in their lives than I think we're often led to believe. They're a surprisingly unhealthy group as compared to adolescents and older adults, and many markers of health worsen for 18 to 25-year-olds as compared to their counterparts on either side of the age range. So just a few statistics that I think you probably all already are aware of, but motor vehicle deaths increase, or motor vehicle accidents is twice the rate that it is for adolescents. So it increases pretty dramatically for young adults. This is a time when substance misuse increases, such as binge drinking, driving under the influence. The majority of young adults are sexually experienced at this point in their life, and so for young adult women 18 to 24, they represent the highest unintended pregnancy rate, and also 20 to 24-year-olds have the highest STI rates. Again, probably not surprising statistics to many of you on this webinar, because these are a lot of the issues that you're working to address in your programs. Mental health is a major issue for young adults. It's a critical period for the emergence of mental health issues. Rates of mental illness, increase in young adulthood. 3/4 of lifetime disorders, mental health disorders, begin by age 24. Which is remarkable. So this is really a key time for identifying mental health and getting supports in order. Suicide rates are 3 times higher in young adults than in adolescents. So this is a topic that we're going to specifically address in our April 8th webinar, and we'll explore some of these issues in much more depth. So as it relates to healthcare, all of this obviously is happening at a critical time when young adults are legally transitioning from being considered children to now legally being considered adult, and it seems like it happens for them overnight. We put this responsibility on them without much training or a safety net, and particularly when it comes to managing and navigating their own healthcare, it's a very confusing and frustrating process. Even for the most experienced adults, we find ourselves often frustrated with navigating the healthcare system, or it takes time and it takes experience. And so for young people with little training, this can be even more frustrating, and they may choose to skip it altogether. So despite changes that came with the Affordable Care Act that allowed young people to stay on their family's insurance plan up until age 26, young adults still experience the lowest insurance rates of any group in 2018. They also experience higher rates of insurance coverage interruptions simply because of changing school, employment, and family status often. So what coverage they do have, it may be changing frequently. They also have significantly lower use in general of healthcare, so they're accessing healthcare less, but have significantly higher rates of accessing the emergency room and care there. So again, let's pause. What does this all mean for young adult health? When we put it all together, we think about the interrelated developmental tasks that they're working to accomplish that I talked about at the beginning, the context of the world around them, social determinants of health, things that are happening in their world. All this kind of accumulates at a critical time, and when many of the critical risk factors that they experience are getting in the way of their health. So this is all coming to a head for young people when they're at this key developmental moment of transitioning to taking care of themselves, maybe changing where they live, moving out and away from some of these systems and social supports that they've counted on for so many years when they were children and younger adolescents. So if you think of families, they're changing schools, maybe sports or arts or other youth development activities that have been a key part of their life, pediatric healthcare, foster care system, all these systems of supports seem to dissipate for them. And they move into an adult system that's not really designed for them and not really designed for their care. And we're often leaving them to navigate much of that on their own if we're not designing programs to support them and transition them, which there is obviously lots of, or some examples of great ways that people are trying to transition young people and train them and support them as they transition, particularly in their healthcare. So now it's time for me to be done talking, and really would love to hear from all of you who are on the call, because I know many of you have attempted strategies, you work with young adults, and at the very least, you've thought about it. And so we want to hear from those of you who have implemented young adult strategy or have young adults as a key part of some of your programming in the States. And then we want to move to talking about, for those of you who are thinking about it or you've had these conversations, where can you go from here? What has sparked your thinking and some of the things that we've highlighted in the last 40 minutes? And what do you need support with, either from our center or from your colleagues around the country? So I think Rena's going to unmute people's lines, and then you can mute them if you're not talking. But if you'd like to speak up, we'd love to hear from some of you about what your examples of working with young adults are.
So we are unmuting all lines, and if you are not speaking, you can also remute your individual line, but you are welcome to go ahead and jump in, or you can continue typing some comments in the chat box.
I know we have a few states who we had talked to before the webinar who had some examples of ways that they were working with young adults, or at least planning some programs around young adults. And so for those of you, if you are on the line, and we would love to hear your examples and what you could share with the rest of us on the webinar.
And if some of your examples are strategies that you have attempted in the past, or specific young adult strategies in the context of a program that you have done recently, that's okay too. We're really interested in learning more about where young adults are intersecting and what some of those challenges and opportunities are.
Hi, this is Mariah Geiger. I'm having a hard time getting unmuted. Can you hear me?
Hi, your voice is very, very low. If you're on a speakerphone, perhaps move a little closer.
Interesting. I'm on a headset, but it feels a bit off right now. Hold on one second. Hello.
Oh, that's much better.
Okay. I adjusted it manually. Tech exciting stuff. So, okay, hi. This is Mariah Geiger from Wisconsin. And in Wisconsin, we have been recently sort of focusing on a variety of different age ranges within our programs. We are also lucky enough.
Hey, Mariah, could I ask you to stop just one? We're all having a hard time hearing you. It was fine for a moment. Are you able to hear Rena?
Hi.
Oh,
Okay.
that's much better. Thank you.
Fascinating. All right. That's
you.
exciting. I apologize for that. So yes, so we are In Wisconsin, we may have noticed from our titles, if you ever email with us, that we do have adolescent health consultants that focus on certain age ranges. I'm actually the earlier end of the adolescent health spectrum, but I work very closely with folks who are working with people transitioning into young adulthood. And so one of the main ways that we have been incorporating that is through our sexual violence prevention program. We have rape prevention and education grant from the CDC that is built into our adolescent health program, which I know that not every state does. And while our PE is actually focusing on all age groups and even possibly looking to focus on younger age groups or start with younger age groups, that young adult population ends up being a really, really key stakeholder. Other efforts in Wisconsin are very similar to what other states probably have going on regarding youth healthcare transition. And so that's a huge effort in our state. And then we tend to include a really large group of adolescents in our statewide youth advisory board, which is the Patch Youth Advocates for Health. So we have everyone from age 13 all the way up into that emerging adults, 20 to 24-ish range on that group as well. And so the biggest challenge I would perceive to working within young adult health in Wisconsin is that like many of you, almost 100% of our efforts are federally funded. And so one of the main areas that they fit into in our adolescent health program is usually funding up to only age 18 or 19. But we do have also young adult health built into our maternal and child health block grant. And I anticipate that it will continue to grow because of things that we're seeing with goals of increasing social connectedness across all age groups, as well as generally healthcare services. This is emerging as a priority population for Title X and for just general family planning. So lots of little things that I wanted to share with the group, and happy to speak more specifically about anyone.
Thanks so much for jumping in. I really appreciate it. So, are there any of the pieces that we mentioned earlier that specifically played in when you were all designing some of the programs, or pieces that we mentioned that when you were recruiting or engaging some of the young people for these programs, did any of those things come into play, either the healthcare transition or, engaging them in your youth advisory council like you were talking about? Any of those things strike a chord?
Yes, absolutely. I think one of the main reasons why they are such an important population to us, even in spite of maybe not having as many resources for them, is because they're going through such an important time, as you discussed, and otherwise are perhaps being lost in connection with various systems. So especially with that healthcare transition, that's something that we really want to make sure that we avoid. And as we actually hear from our children and youth with special healthcare needs team all of the time, children and youth with special healthcare needs are actually in Wisconsin excelling in their transition much more than children and youth without special healthcare needs. So there's still a lot of work we have to do there. So yes, definitely what you said about the healthcare system strikes a chord. The other area that I think is important to discuss is the level of connectedness. We definitely utilize youth voice whenever we're creating widespread messaging, and often our young people help us create that or help us share it. And we have sort of the ability, we've done a lot of working with young people virtually as well, which can sometimes feel stilted or stuffy, but if you can figure out how to meet the tech generation where they are, it actually makes a lot more sense to meet virtually a lot of the time and makes things much more accessible. So like our statewide youth advisory group is 100%, except for one training per year, they are 100% virtual with one another. And the connectedness has been a facilitator of that, I would say.
Mm.
So there's a couple of things to point out.
Mm-hmm. Yeah, that it's interesting to think about when we do go to virtual platforms, that how we're able to reach probably a much broader group around the state, right? Than if we're having things where people are meeting in person and they're located one place physically, then that limits our engagement with young people from around that geographic area. So, and it's interesting to hear you talk about how perhaps young people with special health care needs are transitioning better than young people in general because of your directed efforts. So that's exciting and promising to hear that they're successful strategies that could be implemented with the rest of young adults as well. Thank you for sharing the experience in Wisconsin. Is anyone else interested in sharing their experiences working with young adults, or the strategies they've tried, or questions they have because they've reached roadblocks because of some of the issues that Mariah mentioned, funding for young adults?
Lynn, I'm also going to launch a poll while we're seeing if there's other comments and see if there's maybe some other places that young adults are intersecting that you may not necessarily be working directly with it, but that you know that they're intersecting in your state. And I see that there's a number of people on the line who have been part of some of the adolescent well visit work that the Adolescent and Young Adult Health National Resource Center has done. Some of the COIN work around adolescent well visits. I know that there's some that had some young adult strategies in some of those contexts. If there's anyone that would like to jump in, even if that COIN visit, the adolescent well visit work has ended, just what that experience was and where young adults were intersecting and maybe what the challenges were.
Yes, people are responding to the poll. A couple things that I didn't mention were things that you're addressing here, which is, for one, many of our teen parenting programs are addressing older adolescents / young adults who are still adolescents, young adults themselves, and also parenting. So thinking about that group and their special needs. So Kristen from Michigan has said that their network of state-funded school-based and school-linked health centers can see clients up to age 21, regardless of their status. So that is something to think about. Thanks for sharing that. How school-based clinics, even if they're located within a high school, perhaps they can still be a place for young adults to access healthcare. And then Mariah is also saying that if the poll only allowed them to choose one option, so that might be impacting where people are answering. But she mentioned that they're intentionally looking at young adults in reproductive healthcare services, children with special healthcare needs, and injury prevention and transition. Thank you for commenting on those things. Anyone else willing to share, or if there's questions that you have about anything that we've talked about, or comments in general, things that stood out? We have about 5 minutes left before we wrap up. So any questions? I would just like to open up the lines for any questions or comments about anything that you heard in working with young adults. Please feel free to jump in.
This is Rena. If I might call out if Colorado is still on the line. I know you have some very, very deep and active youth development and youth engagement strategies in the state, including youth advisors that are employees of the health department. I'm just wondering what the experience there is working with young adults, if you're still on the line. Or is there anyone else with youth engagement structures, advisory committees, things like that, that maybe you're engaging some of the older youth moving into the young adult range?
All right, well, if we don't have any more questions or comments, I will move us along, and thank you all for participating in the chat box and making comments and thinking about these things and participating in the poll. Before we end, I wanted to just draw your attention to some of the resources that we have through the State Adolescent Health Resource Center, through the National Resource Center, and through the National Network of Adolescent Health Coordinators throughout the state, excuse me. So this slide is just highlighting a few of those things. Oops. This is showing when you go to the website nsaahc.org, we have a specific tab about young adults and maternal and child health, and several resources that highlight how maternal and child health and young adults intersect. So in thinking about those things, there might be some resources that you could use. The National Resource Center published a strategy guide for state and local strategies. It's a fairly new publication that highlights some strategies that they drew from doing interviews with some of the states that were most successful in working with young adults and engaging them in their work. So there's some other resources here that you see, just some general studies and ideas for how you might work with young people. And then, as I mentioned, we're going to continue this conversation in 2 more webinars. So there'll be one on April 8th that addresses young adult mental health and suicide prevention. And on May 6th, we'll be addressing specifically how young adult males interact with maternal and child health and their specific healthcare needs. So we would love to have you join us for those 2 webinars as well. Definitely, if you have follow-up questions or ideas or thoughts, we would love to hear them. And you can reach out to me at the State Adolescent Health Resource Center. You can find us through the National Network of Adolescent Health Coordinators and share resources with us that way as well, and ask questions and ideas that might come up after you digest some of the things that you've heard today. So thank you, everyone, for participating and spending the last hour with us. I appreciate you engaging and thinking about these things, and we'll look forward to hearing from you again soon and for you joining us in the next 2 webinars. Thanks, everyone.